What's the difference between dry needle and acupuncture? You were thinking maybe? Or I get asked like every time we do a dry needling video. Same tool, very similar. Different lengths of the same tool. What we're using right now, you're seeing a 1-inch dry needle. Really skinny, small needle. It's pushing, it's not cutting through tissue. It's a stimulus I'm trying to create locally. I'm trying to stir in a little bit of an inflammatory response locally so that the body brings all those good things that come when we were injured.
And then remind me, were you fearful of needles?
I certainly was. Definitely a little fearful of needles, but the relief that I get is worth it.
Okay. And that's kind of common with some patients that, like, yes, needles, when they hear needles, they're like, oh my gosh, a syringe type needle.
Yes.
Any needle, to be fair, is going to be a little uncomfortable.
Right.
But just like Sam said, the benefits outweighs just a little, you know, temporary pain or prick.
Yep.
And
I feel like I'm at a point where most of the time it just feels like pressure in a way, not necessarily that, but there's definitely ones you said that maybe are a little more sticky that might need it.
That's a really good point, that it should turn into just like a weird pressure, but the spicy ones that we do find, the next needles, your body kind of anticipates that same reaction, so that's why you can kind of be a little jumpy sometimes. So now we're gonna get her traps.
These are my spicy ones. Whew.
Definitely feels looser, not as tight putting the needles in.
I was gonna say, I remember feeling like a lot more pressure, or a lot more like of that spiciness before, but I'm not feeling as much as that now.
That's good, like your body's getting a little desensitized to the needles.
Like a little bit looser.
Exactly.
It's kind of amazing to, you know, gauge progress that way. Like how the needles feel.
Yeah.
While they're going in, not necessarily after, but.
I'm sorry, I'm not trying to pick this up.
Beautiful. So now we're gonna get her T-spine.
Ooh, yeah, right there.
So always gonna palpate
right,
the landmarks.
Right.
Inferior border of her scap. And we're gonna go towards the spine with the needles, and there's a lot of sensitive structures potentially underneath there. Lungs is the most common.
Right.
Don't want to give you a Nemo.
Oh no, that'd not be great. Crazy, I like really feel it in that area of my back. Like when you, even when you press on it with your fingers, it's like, again, they're taking my breath away.
Which is why we're gonna start learning a few exercises that you'll become a little bit stronger. And
I love that. Always want to be stronger.
Yes.
I'm gonna get started all the way up here and then work my way down distally to that knee. A lot of people ask if dry needling hurts. What do you think, Maddie?
No, I was just going to say it doesn't really hurt, but I will say it kind of makes you tense and nervous because the anticipation for them. But once...
Yeah, so that's what we're going after right there.
But when it's in a sweet spot, it's a little tender. It's not a true pain.
Yeah. And that pain, if it is pain...
We remove it, or...
Well, we give it a few seconds for it to relax.
Yeah, but
there's
if it's unbearable...
One. Hopefully the camera caught that muscle twitch right there. Yep.
You can feel like the dry needle
feel like
Heavy?
weight.
All right, then last one right through there. You're a trooper.
No way.
Good. Awesome.
Cool. Thank you, Dr. Brady.
Absolutely.
Yay.
Like looks very Scranton. Northeastern P.
Okay.
Poconos.
Oh, nice. It's the one area I haven't been yet that I would like to try.
It's pretty not much there.
Taurus-wise, maybe a little bit.
They're skiing.
And the Poconos? Did not know that. Where's Seven Springs in relation?
Seven Springs is in Pittsburgh.
Pittsburgh?
Yeah.
Oh,
I think so.
I knew it was in PA.
I think it's in Pittsburgh.
Okay.
Like Jack Frost's Big Boulder.
Oh, yeah.
Near in the Poconos. Lakes, cabin things, woods, rivers. There's whitewater rafting.
How do you say creek?
I say creek, but the locals do say creek.
Creek, right? I used to live in like Deep Creek area,
Oh, gotcha.
and a lot of people that I've met too would say that,
Deep.
and I was like, where does that come from? Like, say creek for me. And they can say it, they just I guess choose to say
Yeah, I
creek.
think yes, they just do it on purpose.
Alrighty. How are these?
Good.
So I want to focus kind of with the needles here is hit the big muscles of her low back, her lumbar. Get her erectors, multifidi, and she also has a lot of kind of QL tension and pain. So we'll show that area some love too. How you feeling with these so far? Sweating?
Yeah,
Good.
pretty much.
Good. Alright, don't be holding your breath. Nice and slow.
Holding the breath's the only way.
No, it's not. Don't do that.
Oh
That was a good one. I felt that.
It like jumped.
Good. You're doing great. There you go.
Lots of Lucy's. Yeah, I accidentally threw away a box thinking that we had enough to fit them. We did not. So, we use them for you. Yeah.
Give me. You cool with 3 more?
Yeah, go for it.
Okay.
Go for it.
Yup. Last one.
I'm dying.
That. We'll do it.
That'll do.
You cool with those?
Yup.
Alright, you're cooking here for 10 minutes. Just think how great the laser's gonna feel after this.
want the black one with Kalkstein and one's a
Thank you.
You're so welcome.
Yeah, I know.
Whoa, okay.
Last one right here, okay?
Mm-hmm.
I just didn't want them, like, anyone to be like, what the hell?
Might be a little pinchy.
It is a smidge pinchy, but nothing bad.
Good.
I mean, and then I had to work.
That's the one.
Yeah, I had to work all the time because I
Is it now? Oh yeah.
That one too. It's like your average needle.
Right, and that's what my parents did. They were like, because I was in counseling.
Average needle. Ooh,
Your
that
undergrad.
was a good one.
That was.
You know what I wanted to say? I was like, my brother ended up going out of state. So they spent like a way more on him. And I was like, can you add up the difference between our and I have that?
What are you going up to today?
So, yeah, I only took out the one social worker. And my job for my gas, my house, or my apartment, my house.
So relative to some of the tissue work that we're going to do here, this is the result of a problem. This is where the pain is. So I am definitely going to treat locally here because this is where he's hurting, but my goal and my focus is more lower extremity and core as it relates to what I want to try to change over the course of time. So I'm going to work this area. He's doing a lot better. Like he said, he's feeling a lot better. He's moving better too in this area. Sorry, sensitive in the foot, but you know, just kind of a couple moments of a little discomfort, and then it's really worth it, especially when you're dealing with chronic heel and calf pain. It's the worst, especially at the end of the day. Plantar fasciitis, stiff in the morning, gets better and then gets worse, is usually kind of the roll that it goes through. Feels like, you said that's exactly what happens? Yeah. Pressure. Good. Hey, Carly, let me help you out. There you go.
Head down like this. Hang on 1 second before you get down on that though.
What's the difference between dry needle and acupuncture? You were thinking maybe? Or I get asked like every time we do a dry needling video. Same tool, very similar. Different lengths of the same tool. What we're using right now, you're seeing a 1-inch dry needle. Really skinny, small needle. It's pushing, it's not cutting through tissue. It's a stimulus I'm trying to create locally. I'm trying to stir in a little bit of an inflammatory response locally so that the body brings all those good things that come when we're injured. So I'm hijacking the body systems, if you will, that way. There's a mechanical release of tension locally to fascia and a stimulus to the nervous system to also release tension in trigger points or in tissues themselves. Blood flow is like kind of a loose term a lot of people use when they're treating an injury. There's a lot of physiological changes happening locally here as well as in the cortex that help with pain. But acupuncture is going to be a little bit more just different language, different textbook, if you will, to what happens in the body. So they use energy or chi, they use lines and meridians, they're stimulating or not stimulating a tissue or an energy. There is, think like this is muscle, joint, local problem. Acupuncture be treating like asthma or different systems in the body, and there's different elements along those chains of energy, and they're trying to stimulate it. There's a lot of correlations between different lines, so it's a totally different approach. It's a type of medicine in its own right, if you will, traditional Chinese medicine. And now I'm treating his gastroc. two major heads there that I'm going up, and this lateral belly is definitely hanging out with a little bit more tension in here. You might feel a little jump here, buddy. Good. How you doing up there, Zach?
I'm alive. Trying not to flinch.
You're doing pretty good. No flinching over here.
Oh no.
We are impressed.
Thank you.
So you can kind of visualize that.
Yeah.
A joint restriction in the CT junction here, cervico-thoracic junction. So I'm going to be doing some dry needling in that region, and then particularly where he's getting his pain and where he's noticing it the most is in his mid-thoracic spine, where he's got joint and rib dysfunction here. He feels muscle stiffness through here. On his exam, he had just some joint restriction as well as some trigger points in the areas that I've needled so far. And then you can kind of feel this tension right here that I'm rolling over. It's just some erector spinae fibers that are tight and hypertonic. And I'm going to be dry needling.
It feels like a tightening and then it goes away.
Yep. And underneath my fingertips, I can feel that muscle.
Yeah, right now.
Right there. Yeah, there it is, right there. Let's see if see if you can see that bounce at all. Sometimes, yeah. So a lot of times, physical therapists or even chiropractors, there it is, right there. It's jumping right now. So that's like a pistoning fix. I prefer personally and clinically, I like finding the trigger point, setting the needle in, and then just letting it sit there rather than go after it like that.
Yeah.
But some clients like the trigger point. Okay. All right. Last one is your levator scap. Okay.
I was gonna ask, did you wanna? I was like, it feels like the pain is a little more lower as well.
Sure.
So I don't know. If
on this side?
Yeah.
Yeah.
It goes really far down.
Yeah, I'll be happy to continue that. So I would say, even though it's your thoracic spine, we just get this upper trap involvement, levator scap involvement.
Yeah. Well, especially because that's my normal problem. That makes sense.
Yeah. No, I'll be happy to go down.
It's so painful. I don't know what I did.
Yeah.
Yeah, like all up under there. Ooh.
Yeah. So we'll get into the lower rhomboids. So I get the needle almost horizontal to the curvature of her back, and then I'm just going to gather the tissue in. I'm going to slide the needle in. There we go. I'm going to run out of needles on you. We use different size needles depending on the depth of the tissue, okay? So we're going to let these, were you adjusted earlier today also?
Yeah.
Yeah. And so with Miss Davis, what we did, we didn't do the trigger point dye needling. We adjusted her in a certain way.
Yeah.
Had you seen, I know you've seen it here, had you seen that adjustment anywhere else?
I've never seen, no, not until I got here.
Yeah.
So Dr. Warren did that on me and then did some prone adjusting.
Yep.
And then he did some, I think it was some ART as well.
And there's a big difference here. I think Miss Davis was definitely a rib, and that's all it was, pretty much, right?
I think mine's mostly muscle for sure.
And she felt significantly better when she left here, didn't she?
Yeah.
I mean, she couldn't even take a deep breath in. By the time she left here,
yeah, she
felt significantly better. And because she was so acute, we put some ice and stim on it. And then Aaron actually we have a 25 watt class 4 laser, which is really a powerful modality that we use in the office.
That line of tension within the QL.
We were thinking, with MLK, maybe some people already had.
Okay, that one wasn't bad.
Good.
If not,
yep, I already can tell. Jeez. How come you touching it already caused stuff?
Say again?
How come you touching it already caused stuff?
Me touching it caused stuff?
Mm-hmm.
What do you mean?
Pain. Not pain. Like, I can feel it. Like, dull achiness.
Because the pressure I was putting through it is enough just to kind of bring it to your consciousness.
Your consciousness.
You kind of focus on that.
Gross.
That's why you see all those bodybuilders. Maybe you haven't seen it.
Probably not.
But you might see it on YouTube. When people are working out, they'll have the buddy, their spotter, whoever they're working out with. They'll say they're doing chest, and the guy's on the bench press, and he's repping out some reps, and you see his buddy kind of like tap his pecs. So he's providing information for the guy lifting to really kind of focus in on the area or the muscle he's wanting to target the most.
So weird.
So just for the sheer fact of poking on it,
oh my god,
made her consciously aware of it.
Well, Tawanda, I'll meet you on the other side and we'll get you out of here, okay?
All right.
yeah.
So with the erectors and the multifidi, through this area, we're using just a slightly longer needle. We're trying to get those deep spinal stabilizers, aka the multifidi, with these. So we need a little bit longer needle to reach those muscles. In most situations, we're driving all the way down to the bone.
Great.
Of course, they can't feel that.
Sure.
They can feel the pressure of the needle splitting through the muscle fibers, but they don't know we're hitting bone.
Now I do.
You do now, because I told you, but that's cheating, right?
No.
Good.
Death.
Yeah, that one's a good one.
Winner. Chicken dinner.
Give me one more.
Go till your heart desires.
Oh, don't say that. You look like a porcupine.
Yay.
That's it for the video. If you guys have any questions or comments, leave them down below. I'd be happy to answer them. I myself personally read them and answer them.
You do?
I do. It's fun. I love them. I love them. I love engaging with the people. Aww. Isn't that right? Yeah.
He's a
All right, guys.
guy.
We'll catch you in the next one.